Hi, this is Dr. John Stanton again here, one of the orthopedic surgeons at the Bone and Joint Group here in Clarksville, Tennessee. We talked about the fact that we do total joint replacement here at the Bone and Joint Group, and one of the things I want to talk to you about today was hip replacement, total hip replacement. A lot of people will develop arthritis in their hip, and a lot of times we don't know exactly why. Sometimes as a child there was some developmental problem or a dislocation of the hip, or something that affected the blood supply to the hip, ultimately resulting in significant arthritis in the hip joint. The hip can be treated with anti-inflammatory medications to try to avoid surgery. Often assistive devices like a cane or a crutch can take some of the pressure off the hip. And occasionally we will even do an arthroscopy of the hip to try to evaluate the interior of the joint to see if there's something that can be salvaged and avoid a hip replacement. If, however, the arthritis is significant and affects the lifestyle and quality of living, then we proceed on with the total hip replacement. This model here shows the pelvis on your left and the thigh bone here on your right. The hip joint is made up of two components. The top of the femur, which has a round ball with cartilage covering it, has been removed and replaced in this particular model. The cup, the acetabulum, is also replaced in a total hip replacement. Now in this model, pretty well shows what we do. We use a device like a round cheese grater to smooth out the interior of the hip socket to make it nice and smooth and get down through all the cartilage and through the hard bone down to the slightly spongy bone that can heal into your implant. This represents a porous ingrowth implant. The outside of the cup has a porous lining the bone can actually grow into. That is inserted up into the hip, and then a plastic liner, which is a very smooth material, sits inside this. On the femoral side, on the thigh bone side, the top of the femur is removed, cut flat, and the interior is prepared to accommodate the stem of the implant. Again, the top of the stem often has a porous material that allows bone to grow into it. So once both of these implants are secured in your body, over a period of 6 or 8 weeks, they'll become incorporated into the body, and then they're permanent in there and won't come loose. A smooth metallic, ceramic, or oxinium type material is used to rub against the plastic. All of the implants are made of a very highly polished material to minimize wear, and in people who have high stress situations or have long period of usage of their hip, for example, someone who's in their 40s or 50s, we may use a substance like oxinium or ceramic, which maintains the smoothness for decades. The total hip replacement is, the surgery takes about an hour to perform, and then you're up walking that same afternoon. Please check out our website to see more of what we have to offer here at the Bone and Joint Group. Thank you.